Hello and a very good evening to all of those joining me live on the Facebook page of News 9. I'm Neha. So the COVID-19 recovered patients are returning to hospitals with various ailments. Yes, of course, we know COVID-19 has changed the dynamics of the entire world in more ways than anyone can possibly think of. Even though there is still no vaccination for the deadly virus which impacts us in more ways than we anticipated, people are recovering and they have recovered and given hope to those who have been affected. The complex nature of COVID keeps bringing new aspects of the virus with each passing day. In the latest, COVID-19 recovered patients are returning to hospitals with complaints of breathlessness, joint pain, body ache, fatigue and other such ailments. Apart from it, there have been several cases where patients have succumbed due to acute heart attack. Many patients are also dying due to blood clotting despite being given blood thinners and other medications. To speak more about the complications that the patients who have recovered are facing, joining me over the phone line is Dr. Ravindra Babu, who is the Assistant Director Medical Services at Apollo Hospitals. He has in fact dealt with a few such patients himself. Thank you very much, Dr. Ravindra, and a very warm welcome to you. My first question to you, Dr. Ravindra, would be, would you be able to elaborate on the symptoms that people who have recovered are facing? These symptoms, to begin with, are life-threatening and, so to speak, many people have already died.
Yeah, right. Thank you. Thank you for giving me this opportunity to speak to all the viewers right now. I am quoting my evidence from the JAMA journal, which was from the Rome. Actually, they have studied the patients over a period of 60 days. And then what they have observed is more than 50% of the COVID patients, more than 50 patients of the COVID patients who were admitted to the hospital, after they were discharged, they continue to have the symptoms even up to 60 days following the discharge. Predominantly, the symptoms included especially the fatigue, breathlessness, joint pains, chest pain, visual disturbances, that's the eye problems, cough, loss of smell, and then dry eyes, mouth, running nose, loss of taste, headache, then loss of appetite, and they had a muscle pain and a diarrhea as well. So the symptoms are just not over by the time they're discharged. The symptoms continued even after the discharge and even after up to 60 days after the discharge. This is a very authenticated journal, and these are the symptoms that persisted for the patients.
Right. But you yourself have also, dealt with such patients. So would you be able to elaborate on the symptoms, that the patients are having?
Yes. First, let me tell you that, COVID, initially we thought COVID is something like an acute infection, wherein we thought the patients would be admitted with some pneumonia, and then we treat them, and then they get discharged in a normal condition. That is not true, especially with the COVID. This is not true for most of the patients because even after the patients are treated, they recover from all their symptoms, they are discharged. But if you look at their organ system, it is not normal. When we do a CT scan of a chest for a patient who has recovered from COVID, his CT scan is not normal. Generally, there is a CORAD 3, there is a CORAD 4. It's really in a bad condition, although the patients are not symptomatic. I would just like to elaborate on the number of organs that COVID will have a sequelae. For example, brain. The brain is affected in terms of, patients continue to have headache, dizziness, strokes, seizures. Similarly, the lungs. The people exercise tolerance. This is a very, very common feature what we see. When the people after the COVID, when they try to walk, when they try to climb stairs, they feel that it is not usual. They are having a lot of discomfort. They're feeling breathless. Similarly, we see that in the liver, there is always a liver dysfunction that happens in most of the people. Also, there is a pancreas. We see sometimes the pancreatic enzymes are abnormal. There is also one of the major organ that is affected is also heart. The patients continue to have heart failure. There is a heart inflammation, heart dysfunction, heart attacks. In terms of GI, gastrointestinal diarrhea, vomiting, and even kidneys. The kidney function also is not completely normal for some of the patients who are completely recovered from the COVID.
Right.
So there is a chronic element to this. Although we are not experiencing the symptoms, but the organ system is somewhere compromised, and there is a residual effect of this COVID.
Right. Doctor, correct me if I'm wrong. A few patients are also dying due to blood clotting. We've heard patients suffering from chronic disease even after they have recovered, but dying due to blood clotting is something, not very often heard. Would you elaborate why this is happening?
Yes. As you see, COVID has got a lot of tendency for blood clotting. We see that, the blood, it's a pro-thrombotic condition where the blood keeps clotting, especially the clotting happens in the heart vessels, in the brain, or in other large vessels also, and even in the lungs. In fact, the problem, there is a deficiency of oxygen because of the clotting that has happened in the lungs. So the major thing that COVID is doing is, it is actually making the blood into a solid. Ideally, the blood should be in a fluid status, but here it is converting into solid, leading to a major complications. Yes, unfortunately, we have treated thousands of patients at least Jubilee, Hyderabad, and over the group in Apollo, all over the country. We have seen reports wherein our patients were discharged in a good condition. They were fit for discharge. They met all the criteria, but then we had these reports of sudden death that's happening in the home. People died after all the recovery. There are some instances where people died, and these are all attributed to sudden clotting, especially in the heart, an arrhythmia that comes, or a clotting that happens in the brain. In order to avoid that, these patients are actually, we put the patients who are moderate or severely diseased with COVID, we discharge the patients on anticoagulants, that is a blood thinners. But the problem with, again, blood thinners is, blood thinners also have their own complications. We have reports where patients also died with excess bleeding. That also happens. But definitely, we see that clotting is a big problem post-COVID, and patients have to be, some of the patients especially, have to be on anticoagulants.
Right. Right. Lastly, doctor, I'd like to ask, now that we have come across such severe complications, how important is the post-COVID recovery therapy?
Right. Again, I'm not here to scare people. Okay, COVID has done enough damage to psychologically as well. I don't think it's an alarming situation. But the problem here is, especially the patients who were admitted to the hospital, patients who had symptoms like fever, some breathlessness, or some kind of major problems they had. These are the patients definitely who need a little longer care. Discharge to home after acute therapy is not done. It is not over. They have to return back to the hospital and get a comprehensive check so that all the organs are assessed properly. To understand, for example, we saw new onset of diabetes. Patients who were never diabetic became diabetic post-COVID. Patients whose lung function was completely normal, their vital capacity is reduced after that. Patients whose blood pressure was normal, they have become hypertensive post-COVID. And believe me, this is very difficult for us to understand unless we get some investigations and health check done. Mm-hmm. So it's very important to get back after 3 weeks or even 4 weeks, get a proper assessment done so that, by doing an assessment, we can intervene and reduce the damage further.
Right. Thank you very much, doctor, for joining us with all of those valuable inputs. There you heard it. We certainly have a very long way before we, heave a sigh of relief. And that can only happen once we have a vaccine to combat the highly contagious disease. And as Prime Minister Narendra Damodar Das Modi yesterday said, that this is certainly not the time when you let your guard down. Many thanks for joining me. If at all you like this video, do not forget to subscribe News9 YouTube, like us on News9 Instagram, Facebook as well as Twitter. Take care of yourself. Keep those masks on.